Let's talk about postpartum brain chemistry because apparently, an expert witness in a very large, famous criminal trial going on right now doesn't even seem to understand it. When a woman has a baby, okay, there are lots of changes in hormones that happen that can directly impact what we call neurotransmitters in the brain. Neurotransmitters are these little chemicals that work with our nervous system. These are things like serotonin, dopamine, epinephrine, norepinephrine, and this one that I'm going to talk about now called GABA. It is what Kevin Reddington described in his testimony today with one of the expert witnesses in regards to the changes of progesterone that happen postpartum. So we're going to talk a lot about GABA and what that ultimately means. When a person is pregnant, they have really, really high levels of progesterone and what we call allopregnanolone. Now, these hormones at really high levels increase what we call the GABAergic receptor mechanism. Now, GABA is what we call an inhibitory neurotransmitter. That means that it shuts the nervous system down. It's actually one of the largest, or is the largest inhibitory neurotransmitter that our bodies make. It takes that excitatory sensation, things that create anxiety and overstimulation and fear and worry and things of that nature, and it just shuts it down. It calms it down. It can also calm down things like pain as well. So when we're pregnant, high levels of progesterone and allopregnanolone will increase the efficacy of GABA, and that decreases that excitatory stimulation that happens in the body. You have to have a baby, you got to be calm. When a person gives birth to a baby, immediately following the birth, once the placenta is delivered, levels of progesterone and allopregnanolone drop drastically. It's a huge drop, straight off a cliff. That decrease of hormones creates an imbalance in the neurotransmitter signaling that's happening in the brain. And so sometimes it can feel very disoriented. There's a lot of excitatory stimuli. This is where postpartum anxiety and depression comes from, because it's like all of a sudden you feel all this extra anxiety and stimulation, and you're more susceptible to mood changes during this time. Now, this usually happens within the first 1 to 2 weeks postpartum. And so that's where we see a lot of studies and research occurring in terms of like, all right, we have postpartum anxiety and depression happening as these levels drop, and the GABA levels are changing the way our brain perceives excitation. But there's also this phenomenon, and something again that Kevin Reddington pointed out in the trial, is what happens when an individual stops breastfeeding. So when a woman stops breastfeeding, it usually triggers the cycle of events that increase progesterone. But unlike pregnancy, where it's just like